Hi, I'm Dr. David Hill, and today we're going to talk about how to manage seizures in children. Now, seizures are one of the most frightening events that can happen to a child. A parent watching a seizure is likely to be very, very worried. The thing to remember is that seizures almost never cause death. Death from seizures usually results from being in a vulnerable position, such as driving a car or being on a diving board or up a ladder when the seizure occurs. Usually it's a traumatic event, not a result of the seizure itself. That said, there are some very important guidelines to remember. One thing is, if your child is beginning to seize, make sure that he or she is in a safe position. If they were standing or sitting, get them down to the floor. Try and turn their heads on their side in case there is some vomiting so that they don't choke. Don't stick anything in their mouths. That's probably not a very good idea. They're not going to, in all likelihood, injure themselves to an extent that they're not going to heal as a result of biting down during the seizure. So be there, support the child. Second, you're probably going to want to call 911. Now, if your child has a long history of seizures and you're very familiar with them, you're probably not watching this video, honestly. So chances are you're not comfortable with seizures. Get somebody to get that child help, grab a cell phone, yell out for a neighbor, see if an ambulance can come. A seizure that goes on longer than 5 minutes in a child is considered unusual and alarming, and at that point they may well need medication to help break the seizure. Now, if your child has had seizures before, his or her doctor has probably given you a prescription for a form of diazepam. This is a medication that can usually stop seizures. He's probably given you rectal gel, which you can actually put in the child's rectum to try and stop seizures while you're waiting for emergency medical services to arrive. Otherwise, keep the child comfortable and safe and make sure you get appropriate help. So, how to manage seizures in children? I'm Dr. David Hill.